Hi. The topic of today it is my opinion about adult acne definition. I am Gabriel Clatici, dermatologist, and all my bibliography for this presentation are based on PubMed articles. Let's start. Acne is a chronic inflammatory skin disease with peak of incidence in adolescents and represent the most common diagnosis made by dermatologists. Of course, we have new cases in adult person, and in this moment acne vulgaris is considered to be epidemic in Western country because it is present in more than 40 to 50% of population older than 25 years. Of course, acne is not a simple problem. Acne is not a self-limiting disorder. And, very important, acne is not a cosmetic problem. My view on acne. My view on acne is based on more than 20 years experience in the field of dermatology. And, in my opinion, acne is a chronic inflammatory skin disease with multiple mechanisms, with an important genetic component, with a lot of myths in general population and a lot of negative impact in quality of life, which in adult women is connected with hormonal disturbance, stress and smoking, diet and cosmetics, some drugs, vitamins and nutritional supplements. So let's be granular and make a deep analysis of this definition. Chronic. This means we need an initial treatment and maintenance measures with specific lifestyle and, very important, periodic medical follow-up. Of course, it is inflammatory. This means we need the evaluation of the inflammatory status and the correction of the inflammation in other areas with anti-inflammatory diet and specific drugs to reduce the inflammation. Skin disease. This means we need a medical approach with dermatologists, and we must fight against cosmetic treatment or miracle in 3 days. We have multiple mechanisms involved in acne, so this means we need multiple drugs, both local and general, because we need to influence the main mechanism involved: sebum secretion, keratinization disturbance on hair follicle, Cutibacterium acnes infection, and inflammation. With an important genetic component, this means we don't have possibility to treat. With a lot of myths in general population. This means we need to approach the myths in consultation and to give education for our patients about the truth in acne. The common myths: implication of stress, diet, skin hygiene and cosmetics, infection, exercise, sunlight. Unfortunately, a lot of people think that acne is a consequence of being dirty and poor levels of hygiene lead to acne vulgaris. Totally wrong. Acne is the disease. It is not a problem of hygiene. And a lot of negative impact in quality of life patients. For this, it is important to evaluate the impact on quality of life because the data from the literature show that it is not connected with disease severity. We have lack of confidence, social withdrawal, feelings of insecurity and inferiority, limited employment opportunities, functional and interpersonal difficulties at work, and suicidal tendencies, which in adult women. This means it is not a disease of adolescents. Acne is very frequent disease in adult women, and it is connected with hormonal disturbance, with stress, with smoking, with diet and some cosmetics, with some drugs, vitamins, and nutritional supplements, and we must evaluate all of these components in our evaluation. What means the diagnosis? Comprehensive assessment of the patient condition, and we need to know the story, a personal history of the acne. Of course, we need the patient anamnesis, personal, professional, eating and leisure habits, and of course, physical examination are essential in establish the treatment. What is the principle of the treatment? Holistic approach. First, we must change the lifestyle, sun exposure, diet, skincare. After that, we need local and general treatment. We need laser treatment for acne active, for erythema post-acne, and of course, we could do laser treatment for scars and spots. What are the goals? First, healing and prevention of active lesions and preventing the development of scar. Improving the quality of life of patients and decrease the negative psychological impact. We don't have the cure, but we have control. And very important, we don't have favorable effects overnight. And we don't have the best treatment. We have the best approach according to the disease, to the severity, and to clinical evaluation. Acne, it's a chronic disease requiring adherence to the long duration of treatment. Because acne have a prolonged course, a pattern of recurrence or relapse could manifest as acute outbreaks or slow onset, and, very important, have a psychological and social impact that affects the individual's quality of life. Of course, we have some public health issues in acne. Frequency of disease, cost for medical care and health systems, negative impact on quality of life, antibiotic resistance of Cutibacterium acnes, and associated morbidity. Thank you very much for your attention. See you soon. Bye-bye.